we're going to continue into this theme of canine vaccination as a One Health goal towards human rabies elimination with our colleague from the Friedrich Loeffler Institute in Germany, Herr Dr. Conrad Freuling. Guten Tag. We look forward to your presentation in oral vaccination in Namibia.
Thank you, Charles, for inviting me and giving me the opportunity, or us the opportunity, to present some of our recent work. Just to give you a bit of background information, I'm just checking. So oral rabies vaccination is not a new tool. It has been used in, it has been used in wildlife for decades now, but it hasn't been used in dogs for various reasons. One of it was safety, but in recent years it has gained some momentum, and there's some publications saying that it's perhaps the most underused of all tools in the fight against rabies, particularly in those dogs that can hardly be reached via parenteral vaccination. So, and also in recent years, we have shown that orally vaccinated dogs mount a similar immune response to vaccination compared to parenteral vaccination that was done in dogs from Thailand. And also in Namibia, we have shown that dogs orally vaccinated with a novel vaccine, it's the SBBN gas construct, showed that 78% of those dogs that were offered a bait seroconverted, and 83% of those dogs that were given the vaccine via direct oral application. If you see here this code, you can scan it in and then go directly to the respective paper. Now we're coming to Namibia. Last year, we started a field trial, and the area where we wanted to vaccinate is up in the northern communal areas. It has a very high dog population density with a dog-to-human ratio of 1 in 5. It's a highly dispersed distribution of people and dogs, but it's not, or it's sometimes even it's with a high density. This is the setting. For those familiar with African setting, you have these homesteads, a couple of families, or one bigger family is living together in close proximity between 100 or a couple of 100 meters and 200 meters or a couple of kilometers. There's the next homestead. So there's interconnectivity, I would say, of the dog population. So even if it may seem let's say like a less densely populated area, it would still be sufficient to maintain the transmission cycle among dogs. So when you want to use oral vaccines, you have to maintain a cold chain, and that was one of the hurdles. So we had to ship the vaccine down to Namibia, and one of our colleagues who is working in Namibia, Frank Busch, he also organized the installment of a generator and also deep freezers so that the vaccine could be stored at a central point where we could take the vaccine early in the morning. Prior to implementing it, we had a theoretical background on oral vaccination with all the participants. And also we used mobile phone technology that was introduced earlier by Andy, and we were grateful that we could use this tool as well to evaluate our study in the field. So all data was instantly captured using this mobile app. It's not that you just take the bait and throw it to the dog. There are many things that you have to consider, and Ad Vos was giving a vivid presentation and the training prior to going into the field. And then we had training directly in the field about the mobile app, about vaccinating dogs. And then we had endorsement. Obviously, you need official endorsement before using a vaccine that is not yet licensed in Namibia. And these information were given to the respective councillors of the individual villages. And it was also announced via the radio so that the people they were informed that we are doing a vaccination trial. As I said before, safety consideration was a main issue prior that restricted the use of oral vaccines because of concerns about residual pathogenicity. Here we have used a vaccine with a very high safety profile, and there was a risk analysis showing that this risk is almost negligible. We have informed consent from the owner. We provided an information leaflet with a number. If there is any contact, then people should call this number and they would be given PEP. We would use the handout and retrieve model. That means after offering the bait to the dog, if the dog was eating the bait and would discard the blister, we would pick up the blister, and we handled the gloves, the blisters with gloves. Also, with the help of Fred Law from Mission Rabies, we selected certain areas in the field. And then every morning we had a checklist for our field work. We had cooling boxes where we stored the majority of the baits, and we had smaller cooling bags to be mobile in the field. We had water, we had disinfectant, and we had a lot of rubbish bags, and so that we could discard safely of the blisters. So this is what these oral baits look like. So they were all packed into these small plastic bags. They were taken from the freezer early in the morning, and then they were allowed to thaw so that they would be attractive to the dogs. What we also needed is cars. So we hired a 4-wheel drive because it's it's a very remote area in Namibia where we were in the field. So we needed to have 4x4 cars. So this is what it actually looked then like. It's a very dry area, and you see a lot of dogs running around. And here are some impressions from the field. A lot of kids are around, and a lot of time was spent not to persuade people, but to inform people. They were really interested in vaccinating. You were talking about vaccine hesitancy. Actually, the vaccine uptake for COVID-19 is fairly low in Namibia, but when it comes to the dog vaccination, almost all of the participants or the inhabitants that we asked would allow their dogs to be vaccinated and would even want their dogs to be vaccinated. So we didn't see any hesitancy when it comes to vaccinating their dogs. We had some remote areas. Sometimes people would gather at central places like these cocoa shops and would bring up to 70 dogs to a central place. And then it became quite hectic to vaccinate all these dogs and enter all the data into the mobile phone app. So that would take a couple of minutes for each dog if all the data is required, or a couple, yeah. And this is also a very neat image that obviously these dogs are around children, and here you can nicely see that they're interested in the dog. And he's someone with this bag approaching someone in these homesteads. This is a video showing, you see that the dogs are running away. So they're quite frightened of people they are not familiar with. So it would be difficult to vaccinate them parenterally. So they would have to be kept. And he's nicely placing the baits, just not directly throwing it, but offering them. And they are then readily taken up. And that would all be recorded. This is another one. So she's luring the dogs to the front. And then our colleague from Namibia is approaching them. And then it's always a challenge if you have multiple dogs, but if you're clever enough, it can be easily dealt with. Look, he's just throwing one bait to one side, distracting one dog, and then he's placing the other bait so that that dog is vaccinated. So this were the some of the impressions, and the results is that we covered a couple of areas in the Oshana and Omusati region up in the northern communal areas. And you see these dots. So we separated into different teams, and different teams were allocated to different areas. Sometimes vaccination took place in places outside of these areas, but that was not our main focus to, let's say, get a certain number of dogs, but we wanted to assess the overall feasibility. These vaccination areas were sometimes more than 2 hours away, so we had to start very early in the morning to be there, and then spend the whole day in the field. Again, some impressions here, and the majority of dogs were free roaming, but most of them are owned in Namibia. There's a tendency to more male dogs, and we have a lot of small dogs. We didn't differentiate by the age because that's very difficult to say at what time point it's still juvenile, but we have a lot of juvenile dogs and a lot of small dogs. Large dogs are rarely seen in the northern part of Namibia. So when we vaccinated, we did a lot in the morning and less so in the afternoon because the temperature reached more than 35 to 40 degrees. But interestingly enough, the percentage of dogs that would be assigned as being vaccinated increased in the afternoon. That may be that maybe these dogs were fed in the morning and we're not actively chewing the baits. One thing that is very challenging in Namibia is the logistics. You see here, it's the distance between the individual dog vaccinated, and it's a log scale distance. So meaning some of the dogs are just side by side at central places, but sometimes you would have to travel between 2 and 10 kilometers from one dog to the other. So it's really remote areas, and these logistical challenges are irrespective of whether you vaccinate these dogs orally or parenterally. The bait acceptance was really high, and 93% of dogs were really interested, and there was only marginal variation among working groups. But larger dogs, they tended to be less interested. Here you have a nice picture. People would bring their puppies in a card box, and then we would throw the bait into the card box, and then the dog was eating it. Eating time was really, so most dogs would chew the bait really quickly and would chew it completely. So, and most of the times they would also swallow the bait. So we did a lot to record everything. We did a lot of pictures and evaluated these pictures. I will not go into detail because that has all been published, and I will show you the link later on. At the end of the day, we could verify that we would say 74% of all dogs were assigned as being vaccinated, where we could see that they would chew on the bait and they would perforate the blister. For a number of dogs, we would say we didn't see them chewing the bait because they would be running away. So we don't know whether they are vaccinated or not. And not vaccinated was a small proportion, was only 12%. So there's a likelihood that more dogs than 74% would be vaccinated. And we did some statistical analysis, and we're looking at what was affecting the vaccination uptake. So the chewing time, short chewing time, and if they completely ate the bait was one of the parameters that were identified. What was really important was to get our Namibian colleagues and the stakeholders and the upper management on board, and we informed the CVO for the northern communal areas directly about the progress of these initiatives. And the nice thing about these mobile applications is the instant availability of data that can be analyzed. So Fred Law from Mission Rabies was already showing maps about the number of dogs being vaccinated and so on. And also the people in Namibia, they were very motivated. And so we issued certificates of participation, and we prepared a press release. And that was in our view, it was a huge success because it was well taken up both by the public as well as the dog owners, as well as the veterinary personnel. During the publication, there were a lot of concerns from reviewers about costs. Cost is always an issue for any intervention. We can talk about any any tool, but if it is too costly, it may not be included. But it's hard to estimate costs for these pilot studies if there's a lot of research involved, because that means you spend a lot more time implementing these tools. You have more time spending in gathering data. And here we also paid for the staff. So we paid daily allowances. We had transportation. So we had all the cars and the fuels. We organized the deep freezers and installed them. Then there were people coming from South Africa to install these deep freezers. So that was a huge amount of money. So we have to be careful about the feasibility. At the end of the day, we're targeting those dogs that are hard to reach via parenteral vaccination. So this has to be taken into consideration when we're talking about costs. But to be honest, we cannot really say how much it would cost to vaccinate a single dog, because it was an artificial situation. So we had a lot of challenges, and we were talking about COVID-19. That was last year. And to the right-hand side, you see these COVID plots in Germany and in Namibia. And we squeezed our field trial right in the middle of the COVID wave in Namibia and starting in Germany. So we had travel restrictions before and had restrictions before. So that was very difficult to plan this field trial. It was also difficult to align that with the production capacities at the producer at SEVA. And we also had to consider the shelf life of the vaccine and the shipment, because during those times, the vaccines were shipped. So the COVID-19 vaccines, so there was a shortage of cooling containers for the logistical companies. And in Namibia, we actually wanted to match that with the regular mass dog vaccination campaigns, but that was too, it couldn't be done. There were school holidays, weather conditions needed to be taken into account, let's say flooding. And obviously there are other issues that always have a higher priority than rabies control. In this case, it was foot and mouth disease, where lots of the veterinary staff needed to be involved in vaccination campaigns. So we had some challenges. There sometimes was a lack of awareness for the dog owners, and there needs to be a prior notification of these vaccination via radio and media. We tried as best as we could, but because we selected on the spot these areas, it was sometimes difficult. We did both central point and house-to-house vaccination. Central point was far more effective, but we needed to spatially separate these dogs to be more effective. Based on our safety requirements, we had to have owner consent, but this slowed everything down, because sometimes you would not identify the owner of these free roaming dogs. And then we couldn't vaccinate them, or it took us such a long time. And the same with the vaccination certificate. So they wanted to have a vaccination certificate. We are not in favor of these vaccination certificates, especially if these dogs are not identified. And we would just issue a specific vaccination certificate for ORV. We have published this. You can scan it and find it online. And we are looking to conduct further activities in Namibia to assess mass dog vaccination plus ORV, the efficiency in the field, and the added value during cattle vaccination when they are herding dogs that are very difficult to vaccinate. And maybe there's possibility to assess feasibility and acceptance of owner-based ORV. It's envisaged to have it in November this year in the Zambezi region in Namibia, where they currently have an outbreak, and we want to also use this as an outbreak control tool. With this, I'm finished, and I would like to thank many people. It was a great fun to be in the field, and it wouldn't have been possible without the funding. And this time the funding was from the German Ministry of Health in the frame of the Global Health Protection Program. And with this, I would like to thank you, and I'm happy to take any questions.
Thank you, Conrad, for a very interesting presentation. And when you were talking about owner consent and free ranging, and those excellent pictures for the engagement of children as everywhere. They're very interested, want to be involved. What are the recommendations if a vaccinated dog were to bite or lick a child or another person after vaccination this way?
So we would have said if it was known to us in that sense, we would say PEP, but there's hardly any, or a recent KAP study indicated that not all dog bites are even receiving PEP. So we didn't see any, so there was no notification to our hotline. So we didn't deal with it. I think based on the risk assessment that has been published and based on the safety profile of the vaccine and based on the overall risk of rabies as opposed to the vaccine, you could omit PEP in those that just touch the dog or just touch the bait. That's why we have this high safety profile of the vaccine.
Very good. Thank you. And I hope you'll stay with us for further discussions as we move along.